Good morning, everyone. My name is Tom Sommer. I'm president of MassMedic, which is the Massachusetts Medical Device Industry Council. For those of you who follow the healthcare technology field, you know Massachusetts is home to a supercluster of the life sciences industries, biotech, pharma, and medical devices, and we have a burgeoning health IT sector as well. Massachusetts is actually home to the second largest concentration of medical device manufacturing in the United States. We're behind California on grand totals, and then when you look at a per capita basis, we're behind Minnesota. These are two great states that have different types of medical device clusters than Massachusetts, but certainly leading the country. So running through the numbers, we have 24,000 workers who work directly for medical device companies. When you take a look at the supply base and the multiplier effect, we have closer to 80,000 workers who have their jobs tied in one way or another to the medical device space. That includes 400 OEMs and countless suppliers. When we say suppliers, we talk about law firms, accounting firms, regulatory affairs consultants, contract manufacturers, injection molders, the whole panoply, if you will, of inputs into the medical device sector. We are, like the medical device industry across the country, export positive. That is to say, we are exporting lots of medical devices to around the world, including, and we are actually the number one commodity that is shipped out of Massachusetts each year. So here are some of the big names that you may recognize in this industry. Certainly Boston Scientific, Covidien, Philips Healthcare as well are all part of our cluster. We also have a very small, we have a large contingent of medium and small size companies. I mentioned the supply base as well. It's vibrant, it's robust. It is very much part of what we are doing here in Massachusetts when it comes to the medical device space. To tell you a little bit about MassMedic, we were formed in 1996 after then Governor of Massachusetts William Weld and Harvard Business School professor Michael Porter co-chaired a council on economic growth and development in Massachusetts. They looked at various clusters, and one of them was the medical device sector. It was absolutely the most under-acknowledged positive force in the economic profile of the state. And a report came out from that committee, looking at ways in which to strengthen the medical device cluster. It was established by medical device company executives in 1996 and has grown to become the largest regional medtech association in the United States. Most importantly, what the organization has become is a meeting place for the sector. We have become a place for suppliers and OEMs to meet where a number of very positive things happen. We're looking at collaborations that have come about but for MassMedic. We have looked at legislative victories that have come about because of our activities, key hires, and generally sharing of information. So we bunched that under one particular heading, which is access, and that is we are providing our member organizations access to one another through networking events, information seminars, conferences, things that we put out, issue briefs, and an industry directory that we put out every 2 years. Networking, which is, you all know as professionals, is a critical part of the development of a cluster. It takes place under our auspices, and certainly we have seen lots of business development activities take place, key hires, and special interest groups being formed to support a particular issue within our work. We are advocates. That is, we lobby. We lobby Congress. We lobby the state legislature in Massachusetts, and we've had some particularly nice impact on a number of issues, including those that matter most to us on the federal level. The Food and Drug Administration is our key partner in this industry, and we have looked at and helped them develop user fees, helped them reduce review times, and and are now currently working with them on an initiative of regulatory science. And a medical device innovation consortium has been formed, an industry and agency collaboration to help speed the review of medical devices. We also work on Medicare and in the area of trade development with the U.S. Department of Commerce. On the state side, we've had a number of pieces of legislation that have truly impacted the life sciences sector. I've listed them here. We've had some fairly restrictive language that, or law that passed that really put lots of restrictions on the interaction between industry and healthcare providers. And we were able, after about 4 years of very hard work, to peel back the most onerous provisions of that law. And we've also been involved in a number of positive initiatives, including the formation of a Massachusetts Life Sciences Center, which is a quasi-state organization that supports through grants, loans, and incentives the development of the medical device and biotech and pharma industries in Massachusetts. We also take great pleasure in working with our state government in promoting the state as a location for the medical device industry. We go to a number of trade shows each year and involved in the governor's trade missions to various countries. In fact, next week I will be at the world's largest medical device trade show in Dusseldorf, Germany, called Medica, and we've been going for 18 years, promoting not only Massachusetts as a place for the medical device industry, but also our individual members who are on the lookout for distributors. So a few pictures to brighten your day. Our final objective really is helping early stage companies, emerging companies, get to the next rung of development. So not only are we providing information and access for our members, we're also lobbying on their behalf before governmental agencies and legislatures, but also helping to support the early stage companies among us. We feel very strongly that if we do not participate in these types of arrangements in these projects, then we're not going to be encouraging further growth and further innovation in our cluster. So we established something called MedTech Ignite, which is a coaching program, mentoring program, that provides early stage company executives with a coach, with a mentor that has had specific experience in the area that they are working. So if we have an orthopedics startup company, we'll match them with someone who may have worked at Johnson & Johnson's MyTech organization for a number of years and is looking to support and give back, if you will, to the industry. There's no money that's exchanged here. We have it's strictly a voluntary basis, and we coach these companies for a period of about 3 months, usually helping them develop their business plan, and then they, we hope, are more investor ready than they were before they went through the program. We also have something called a shadowing program, where we take entrepreneurs, medtech entrepreneurs, and couple them with clinicians and have them shadow or follow them for about a period of about 2 or 3 months. So we have 2 hospitals, teaching hospitals in our region that have agreed to sponsor this. We have Bay State Health Systems in Springfield and Boston Medical Center. And we now have about a dozen such entrepreneurs paired with clinicians. And the thought is that by following them around, following them on rounds, going them into surgery, meeting with patients, they're able to observe particular unmet clinical needs that they can then tease out a technology that may become the basis of a company, or it actually may just be the technology that is licensed. But it's definitely, as I mentioned, working now. We're waiting to sit down with the first crop of entrepreneurs, and hopefully that we'll be able to meet with some success and maybe developing some new companies out of this very direct relationship with academic health centers, teaching hospitals. I'll wrap it up there because I've got 10 minutes and I'm just about at that point. This is my contact information. If you have any questions about anything I've just said or will say on the panel, please feel free to connect with me. Thank you.